Take it away, Mr. Smith.
Thank you. Good afternoon and welcome to all Team CMS, school-based staff and employees forum. We wanted to bring this together. I know last week we asked for some submissions of questions that you might have as we ready to return eventually to some in-person instruction in a phased approach. We received almost 200 questions in just a brief period of time and wanted to provide this opportunity to have some of your peers, some school-based staff, ask those questions of some of the subject matter experts within CMS district leadership. And we've brought those groups together today. I'm Patrick Smith. I'm the Assistant Superintendent for Communications for CMS. And we do have here a panel that is put together to help school-based staff, teachers, employees have their voices heard as we prepare to move forward with our plans to return to in-person instruction down the road. I'll turn it over now and let our panelists introduce themselves. They'll introduce themselves and their roles within CMS, and then we'll proceed with the question and answer session. I will say before we start the introductions that we have scheduled this meeting for 4:30 p.m. to 5:30 p.m. We will try to answer as many of the top questions that we received as we possibly can. And any of those questions that we're not able to get to and answer within this hour, we will provide, this meeting will be recorded. We will provide a link to the recording to all staff tomorrow morning, as well as links to any of the materials or training or any of that is mentioned during the meeting. We'll have those links, and we'll also have the questions we did not get to and answers to those included in that information that we share. So panelists, please take it away.
Hi, I'm Colette Rogers, and I'm the Executive Director of Total Rewards within HR.
Hi, I'm Randy Davis, and I'm an Internal Communications Specialist with our Communications.
Hi, I'm Monica Damian. I'm the Coordinated School Health Specialist for CMS.
Hi, I'm Laura French. I'm the Executive Director of Employee Relations and Human Resources.
Hello, my name is Melissa Daver. I'm Benefits Manager in Human Resources.
My name is Jeff Mitchell, Manager of Environmental Health and Stewardship.
Hi, I'm Kim Tuttle. I teach English at Levine Middle College High School, and I am the 2019 CMS Teacher of the Year.
Hi there, my name is Haley Rowley. I am a 4th grade teacher at Renaissance West STEAM Academy.
Hello, my name is Amanda Thompson. I'm a secondary math specialist.
Well, thank you all for joining us today. And to get right into the Q&A session, we'll get started and we'll have Kim ask the first question, please.
Hi, good afternoon. So the first question is, if a teacher has to be quarantined for 14 days, does that come out of our sick leave?
Hello. No, it does not. A teacher can actually apply for a federal leave, the emergency paid sick leave, in order to have that time covered during their self-quarantine.
All right, our next question. If an employee tests positive, will the rest of the staff be notified so we can decide if we need to be self-quarantined or not?
So if a staff member or a student tests positive for COVID-19, we always are going to work closely with Mecklenburg County Public Health to assist us in determining relevant details regarding that case. Every case may be a little different. And you'll hear me say that over and over again today, but first we'll need to determine if the person was on the school campus while they were potentially infectious. And what that means is they would be on the campus during 48 hours before symptoms developed. So if a person was in a CMS building during that time, we would then need to identify and notify anyone who may have been exposed. And we define exposure through what we call close contact. And that is when you are within 6 feet for more than 15 minutes of the person who was infected. Anyone who is in close contact would be instructed to quarantine for 14 days from the date of exposure. We also provide general notification school-wide when someone in the building has tested positive. And if you were identified as a close contact, you would receive additional information and instructions. Any notifications must maintain confidentiality in accordance with state and federal laws. We also would complete enhanced disinfecting if someone had been in the building during their infectious period.
Our next question. We have already had an employee test positive in our building. We're sharing communal areas with our coworkers. What's being done to ensure commonly used areas are disinfected? And then also, when do we close the buildings after how many positive cases?
So for the first question, I'll answer that one is the principal or the designated person, whether it be the AP or whoever the principal is designated, they'll reach out to their contact person and they'll get in touch with myself or somebody with operations, and we'll discuss the what the application was, where the person was, how much time. So after we have determined locations where the individual spent a significant amount of time, we would then determine those locations, close those locations, go in and do electrostatic disinfection of those locations. Our goal is to try to do those the same day that we receive notification. If we're told that that room or location will be closed down for a day or more, we may wait 24 hours and go back and do that room at that point. But as far as if it's something that needs to be put back in operation quickly, we can respond to that as well, and that's typically what we have done. As far as the, I think the second question was when will we close the building? I was going to say right now, I believe there's some metrics being looked at right now for that. I'm not sure if there's an exact number right at this moment. If there's somebody else on the panel who can answer that, then
I'll finish that answer. So again, like I said, you'll hear me say over and over again, a lot of the decisions are a case-by-case situation, and we'll work closely with our county health department to determine the level of concern in a building. One case will not typically lead us to shutting down a school building. As Jeff said, we may block off a certain area for disinfecting, but the entire building usually would not be closed down, but the decision would be made in consult with our public health experts.
Okay, the next question. How will CMS handle positive COVID cases in the homes of teachers within the district who are taking care of others who are quarantined?
So if an employee is caring for an individual who has been advised to self-quarantine or isolate or is experiencing symptoms of COVID-19, they are eligible for FFCRA, which is a paid leave for up to 80 hours.
Thank you. Next question. How is it determined who would need to be quarantined and who would not? And is it supported by the most scientific studies of how COVID-19 can be transmitted?
So, excuse me, quarantine is advised if you're a close contact of someone who is tested positive. And again, a close contact would be somebody who you were within 6 feet of during the infectious period for more than 15 minutes. Household contacts or household members are also considered close contacts. But in a school setting, we would first need to determine whether the individual who tested positive was in the building within 48 hours of developing symptoms. If the individual was in the building, we would work closely with the health department and the school staff to identify anyone who may have been in close contact with them during that time. And again, close contacts are really determined case by case. Staff may have more close contacts with other adults in the buildings, and younger students sometimes may be in close contact with others in the classroom if they're not social distancing, but they can also only be a close contact if they're sitting really closely to somebody. So again, it depends on the situation, but it's important to remember social distancing may prevent you being identified as a close contact and prevent you from needing to be quarantined at all. As for the scientific basis for the information we use, everything we use, our guidance and procedures, are developed in consultation with North Carolina Department of Health and Human Services and our local health department. We want to ensure that we're following the most up-to-date evidence surrounding this illness, but we also know it is a new illness, and we have to acknowledge that our guidance and understanding may change over time. And this is really part of the scientific process of learning about something new, updating your prior understanding, and adapting to incorporate that new knowledge and best practice. So we really do look for the most current information and make sure that what we're advising is evidence-based.
Thank you very much. Will staff members who work with EC students be provided extra PPE like face shields as noted in the CMS Getting Back to School document? As of now, we've been told that there are only masks, hand sanitizer, and sanitizing wipes available.
They will be provided. I received an update earlier today that that equipment has been purchased, so they will receive the face mask as they were requesting, since they will be working typically with that student population's possibility of a spittle or things being transmitted. So that was something that was put priority to get that equipment to them.
Great. And I know this was kind of brought up a little bit before, but if an employee tests positive, will the rest of the staff be notified so that we can decide if we need to self-quarantine or not?
So at the school level, communications will be developed to provide appropriate information to staff.
All right, this next question is multi-layered, so I'm going to say all the questions and you guys can put it together. All right. What is the metrics for deciding if only a class needs to be quarantined or a whole school needs to close? What will be in place to handle social emotional needs of the students and staff in the event that we open and suddenly have to close again at some point? This is a very real concerning factor, and we have opportunity to interact again and then suddenly it's taken away.
So I'll try and answer it all, but if I miss anything, you let me know. Each case, again, has to be evaluated in consult with our public health experts. And so there are lots of different factors or metrics that we consider in the scope of who has to quarantine or whether we have to close a building. Some of the things we take into consideration are the number of cases, the potential for cases to be linked within a school setting. It's really important to keep in mind that just because we have a positive case in a school does not mean that the infection was contracted at the school. So there would be a different concern if we felt like there was transmission within a classroom or within a school building versus someone who went to a Labor Day party and contracted it outside of school. So those are important metrics to consider. Whether the individual who tested positive, again, was in the building during that infectious period when they may have been developing symptoms. And again, we also look at the community spread in general and the disease trends that we're seeing to put all of those things into consideration. In regards to the social emotional needs of our students and staff, we recognize that this is truly a collective trauma we are all experiencing and having to live and manage through. As always, our school counselors, social workers, and psychologists are available to support our students. They're there to support social and emotional needs, behavioral needs, mental health, and academic support, both in the buildings, but also while our students are learning at home. In the remote environment, it's really important for us and for our parents to remember to communicate those concerns directly to the student services staff. It's much easier when the staff are interacting in person with the students to get a feel for what's going on, but sometimes things can get missed in the virtual environment. And so we want families to reach out and request assistance. As far as CMS employees I know there's free access to life care services, and there's Reconnect for Resiliency, a partnership with the county. I don't know if any of my other HR benefits friends want to speak to anything else as far as providing support.
I was just about to say it.
You hit the nail on the head with regard to Life Care as the EAP services that's available for employees and their families.
That's correct.
So the next question is, we're receiving lots of information about cleaning standards, but COVID transmission from surfaces is much less common than transmission via the air. What is CMS doing to address concerns of poor ventilation in some facilities?
The operations department, they have started increasing airflow to the buildings 10 to 15% in order to introduce more fresh air into the buildings that have outset of air capability. They've also scheduled the HVAC schedule to provide conditioned air for longer amounts of time. And currently they're in the process of going through the district and upgrading all the filters in the system from a MERV 8 to a MERV 10. In addition to that, they're also, which is going to allow for some additional filtration of particles in the filtration systems. And then additionally, they're checking the exhaust fans to ensure that the exhaust fans are pulling air so that they have proper function of air movement through the building. So they are taking steps to, because I know there is a concern as far as we're kind of looking at the disinfection, the cleaning and all that, but operations is also looking at the indoor air as well. And that's the steps they're taking.
Right. So this is a multi-layered question. What if a student comes to school with COVID and exposes me? Will I have to quarantine after contact with this child? Will I be paid to work from home? Will I have to use all of my sick time or take unpaid leave? And how is this fair if the child exposed me, then I have to take unpaid time off?
Okay. So there's a few pieces in this question. So if a student comes to school and with COVID and exposes the teacher, they would have to contact the health department or medical provider to determine if they were a close contact and if they need to be quarantined. You can apply for, we're using the acronym FFCRA, which is the Family First Coronavirus Response Act, and that is a federal paid leave. But you would have to apply to determine if you qualify for this paid leave. It covers a number of different categories, and one is if you've come in close contact or if you've had to be tested and you're waiting for a diagnosis or the test results back. If you do happen to use sick time during this FFCRA application period, it will be returned to your leave bucket so that you will have the opportunity to use the FFCRA paid leave. And if you choose to work from home and you're approved by your supervisor, if you're working remotely, you will not have to take a leave.
All right, next question. What are the requirements for staff and students to return if they have tested positive previously? For those who have tested positive, do they need to have a negative test before returning to the school and/or work?
So if someone tests positive, they are typically followed pretty closely by healthcare providers and/or the public health department, and they will monitor their symptoms and make sure that they're released from isolation before they return to school. Staff or students who've tested positive have to be able to answer yes to all three of these things in order to return to school or work. It has to be at least 10 days since symptoms started, or if they were asymptomatic or never had any symptoms, at least 10 days from the date of the test. They also have to be without a fever for 24 hours with no fever-reducing medicine, and they have to see improvement in all of their other symptoms as well. It's not recommended to repeat testing after a positive test. The evidence is showing now that some people can still test positive for months after all of their symptoms are completely gone and they're no longer infectious. And it's best to just follow the recommendations of your provider and make sure you're feeling healthy before you come into the building.
Next question, how will the school be cleaned? Currently, the classrooms and restrooms are not being cleaned. Only the trash is being dumped daily. My classroom has the same muddy footprints from 2 weeks ago, and I clean the teacher restroom myself each day. What protocols are supposed to be occurring currently when children return and if positive cases occur?
I'll answer that one. So the rooms and offices should be wiped down each evening. That's with the cleaner and disinfectant to ensure a clean and safe environment. A task list has been provided to custodial services, along with they're actually doing some additional training, I believe, actually this week as well. And I was going to say, if there's a concern as far as the cleanliness, we would ask that they reach out, whether through their principal or whoever their person that's their contact, to try to or to reach out to the custodial area services leader or a supervisor, because unless we know about an issue, we're not going to address those issues. But if there is performance or concern about performance, the big thing I would ask is that we do get notified. Specifically the area leader. Most principals are aware who their area leader is, and if they're not getting response they want there, then I would ask they elevate it to their operational supervisor or directly to the director of custodial services, and they can get a response on that. But I mean, they do have checklists. They are supposed to be cleaning, doing those things. And I think there was a second question about some type of cleaning or disinfection. I think there was a two-part question maybe.
What protocols are supposed to be occurring currently when children return and if positive cases occur?
So kind of answered a little bit earlier as far as the positive case is, again, the principal would notify their contact. We would discuss the situation, if the person was in a classroom, for instance, and maybe a teacher's lounge for a significant amount of time, we would close those two locations and perform disinfectant cleaning or disinfection in those locations. And custodial services would also go behind us once that area had been disinfected, do additional cleaning on top of that. But again, as far as the primary question, there is task in place that's supposed to be being done. So we just need to be notified, or area leaders or the director, supervisor, to be notified of the concerns, performance concerns.
All right, thank you. If my child, who is at a different school than myself, is quarantined due to a possible exposure at their school, do I stay home as well?
The employee does not have to quarantine. However, the employee who is caring for the individual who has been advised to self-quarantine or is experiencing symptoms can apply for the FFCRA leave.
That leave is very important. We heard a lot about that leave today. Here is our next question. If a staff member or student has symptoms of COVID at school and has been around fellow staff members or other students, what are the procedures following a positive test result from a doctor? How are we notified, and what will be the procedures for cleaning?
So the first part of that related to somebody developing symptoms at school, the first thing I want to stress for all of us to remember is if you start feeling sick, you should stay home, especially if you're having any of those symptoms on the screener, things related to fever, chills, a new cough, shortness of breath, or the loss of taste or smell. Those are definitely symptoms that should tell you to stay home. If you develop symptoms during the day, certainly you can't control that, and we recommend anytime someone's not feeling well, especially right now with COVID, but even anytime we have all sorts of viruses that go through the schools, and you should just stay home and get better rather than be in the building. We do have protocols in place. If a student starts having symptoms during the school day, once they've been assessed to need to be isolated, they would be placed in a designated space until a family member could take them home and receive medical care to determine whether the symptoms are indicative of COVID-19 or an alternative diagnosis. But that would be the recommendations. And certainly for staff, we just recommend that they go home. It's important for everybody, for all of those reasons, to always wear your face covering and stay 6 feet apart anytime you leave your home. Again, if someone was in the building when they were symptomatic, we would work with public health to notify anyone who had been a close contact and advise them to quarantine. Notification of exposure may come through a letter from Mecklenburg County Public Health or a phone call. And again, reiterating what Jeff said about the cleaning procedures, if someone has been in the building while infectious, it would just include some specialized disinfecting that would be focused on the areas of the building in which that person spent significant amounts of time. Did I cover it all, Amanda?
I'd just like to add one quick thing, that's all right. Some of the things that came up in the past have been somebody gets cold, they're direct contact, and they want to run out and take a test right away. I was going to say, Monica, maybe you can speak to this, but I was thinking at one point the health department was recommending 5 to 7 days. Some folks are going out and getting tested, they get negative. They're not able to come back directly right away. The concern is that there's a long incubation period of the virus. That's why we tell people you're going to be out for 14 days. So that gives time if the virus is, if they did come in contact, so the virus has time to incubate and start to show up. Last thing we'd want is somebody go out, take a test, get a negative, and return right back to school, and then bring that into the school. But I was going to say, you know, there's been some questions about, can I get a negative test and return right back to work? And the answer is no.
Yeah, that's a good point, Jeff. So if someone has been identified as a close contact and have been instructed to quarantine for 14 days, that quarantine period isn't just random. That 14-day period is the amount of time it can take for somebody to start developing symptoms after being exposed. Typically, people do develop symptoms within 2 to 5 days of exposure, and that's also why we don't recommend that you run out and get tested immediately after hearing that you may have been exposed. So if I was exposed to someone who had tested positive today, the recommendation is to wait at least 5 days before I get tested, because my body may not show the signs for the test to pick up a positive. And again, if you are identified as a close contact of someone who's tested positive, even if you go and get tested and receive a negative test result, you need to stay out for that 14-day period to make sure that you don't develop symptoms later.
I guess
we have a lot of questions about that. Go ahead.
One of the parts of the question is, what would be the procedures for cleaning? So I guess I want to know, like, in detail, like, I guess a general in detail, what would be the procedures for actually cleaning if someone did test positive for COVID at school?
So as far as that goes, like I said, we identify, let's say it's a classroom or, you know, 2 classrooms or whatever it may be. We do have this electrostatic sprayer. So the equipment actually throws out a aerolized material, disinfectant, EPA Enlist certified registered product. It actually, since it's electrified, it does curl underneath the underneath the table. So what it will do is it actually sets on all the surfaces, disinfects all those locations. So we go through and basically go through the whole building, or excuse me, room in question, and we'll go through all the surfaces, spray those down, and like I said, that's going to be the tops of the surfaces, the sides, the underneath, because it is electrostatic. It can curl underneath. So we chose that route as opposed to having to go in and do wiping, which is going to be hard to get behind bookshelves and different things. But with this, you know, electrostatic, it's like a mist essentially. It can go behind the bookshelves. It can go behind different places that your typical wiping and hard cleaning with rags cannot get to. So we would go and do that. Wait at least 1 to 2 hours for everything to settle down in that room. And then typically what we try to do is do that, and then the next day, you know, have custodial services do a standard cleaning in that room. My apologies. But like I said, it's basically electrostatic followed by a traditional custodial services cleaning at that point. I believe that answers that second part there.
Thank you.
Thank you.
Okay. During the 2 weeks of work days, no PPE was given on the first day, and my office was never cleaned throughout the week. 2 masks were given on the second day. Staff bathroom was out of soap for 3 days, not cleaned throughout the day as 50+ people were using them. How will CMS ensure consistency across the district for cleanliness and protection of employees?
I'll answer that one as well. On that one, all sites do have a designated PPE contact. Likely the principal has designated that person, but they all do have contacts. In certain cases, I know before school started back, there were some deliveries to a lot of schools. In some cases, individuals may not have realized the equipment was there, but I believe those issues were sorted out within the first day or two. But if there are concerns, they can go to their PPE contact. They can make requests, and based off requests, we may be able to fill those, or the district can fill those requests. Some things are being looked at as far as equitably make sure it's been distributed correctly. As individuals or schools may ask for 10 times as much as another, we do have to look at those things to make sure it's being distributed correctly. But as far as that first question, I would say, a contact with a PPE contact, there may have been supplies there, or it may be something they have to request. As far as the, I think the other part was a cleaning concern. It's kind of similar to that first question, or earlier when I had the question is, there are stipulations and, tasks in place. So again, I would ask that the principal reach out to their area leader. If they're not getting response they're looking for from the area leader, then I would escalate it to the supervisor or even directly to the director of custodial services as necessary. But I mean, we do realize that cleaning is absolutely a huge part of this effort for the staff and the school in general.
So can I follow up on that? Will you just run through briefly again real quick the chain of command in place for when an employee feels like cleanliness standards are not being met?
So what I would say is if the principal could reach out to the area leader. So you have, I guess the structure is you got the director of custodial services, then he's got, I believe, 3 supervisors and 9 area leaders. So the area leaders are above the head custodians. So I would say go to the area leader, and then if they're not getting what they're looking for, the supervisor or director, that department would be the next route, I would say. But again, I do encourage to go to the area leader first, just to see if they can resolve the issues. In most cases, I think they could do that.
Right. So as we know, the pandemic is causing a great deal of anxiety for our students and for our staff members. Should a student or staff member test positive at school, would remote work be offered to them?
So if a student or staff tests positive, they would need to follow the guidance provided by their medical provider or the healthcare department regarding quarantining. The employee would be eligible for the FFCRA leave, which again is the paid leave for up to 80 hours. Now, if the employee chooses to work remotely or they would like to, and the supervisor approves it, then they could work remotely during that quarantine period.
All right, thank you. Next question. How will we do contact tracing at the school?
So contact tracing is a process that is initiated when the health department identifies someone who tests positive. They reach out to that individual and inform them of the need to isolate, and then they do some investigation to find out when they started having symptoms, what types of symptoms, and based on that, who they were around during that time that they may have exposed. They also look to try and find out if they can identify where they may have picked up the infection. So contact tracing happens through the health department. And then again, within the school system, we work closely with the health department. If someone has been identified as being infectious while they were in a CMS building, we would assist in that piece to figure out who may have been a close contact of that person in the building and inform them and instruct them on quarantine. Tracking of cases will be also conducted within the school so that we can monitor compliance of public health requirements. So when someone is identified as a close contact and needs to quarantine, we'll be monitoring to make sure people stay out for the period that they have been instructed to stay out for.
I have two children who are both enrolled in CMS elementary schools. If one of them must quarantine at home, will I be able to work remotely, or do I have to take a leave, or do I have to use sick days?
So you would have the option, if the supervisor approves you to work, that you're able to work remotely, you can work remotely, or the employee may apply for the federal FFCRA leave for childcare.
All right, and my last question is, if an employee is waiting for test results and test positive, will they have to use sick days, annual leave days without pay for the time they are quarantining, or will they be allowed to work from home?
Similarly, if an employee is waiting for a test results, if they'd like to work and they can work and they've already been approved by their supervisor, they can work remotely. However, they still are able to take advantage of the FFCRA leave, which again is the paid leave.
Okay, I'm going to jump in with a specific question that I have here that is kind of under the realm of operations. A teacher who teaches in CMS has an issue, hypothetically, with a classroom window that doesn't open. What's the streamlined process for reporting that and getting that taken care of?
I mean, the typical process is doing a work request. Sometimes, different schools designate different people. Sometimes they'll have a custodian put it in. Sometimes it's the front office staff will put it in. And the big thing sometimes is verifying that when they request it's put in, to actually check back with that individual, make sure it gets put in, because there have been situations where there's a delay in that being put in. And then sometimes, there's a delay in getting to it. But I was going to say, the biggest thing I can always ask is just the more information we have, the better, because there are different ratings when things come in as a 1, 2, or 3. And if something comes in with little information, it's possible it could be mischaracterized. It could either be elevated too high or it could be elevated too low. But I was going to say, the big thing is to follow wherever the school's procedure is as far as putting in a work order, or a work request, and just provide as much detail as possible. And again, if they can just follow up and make sure it actually did get entered so that we actually did receive it.
So in the meantime, will the teacher be expected to hold class with the students in that classroom while waiting?
As far as the window?
Like if there's no ventilation to the outside air in the classroom?
I was going to say, if there's a concern there, I was going to say in most cases, the principal can move them to another location if there's a available. I'm assuming with a phased approach, there'd probably be additional rooms that are available. So I would say if the concern is enough for the teacher or students in that case, in the event we couldn't get to it right away, I would say the next step would be to locate to a different room. But if it's an issue where it's going to be a relocation of a student and staff, that typically would be a 1 or 2, which would be a 20, at same day or 48-hour request in that case, most cases.
Thank you.
So I have one more question. For employees working at the Education Center building, will staff be notified if someone in the building tests positive for COVID-19? Or will be notified and the employees are working only in the suite? And since we all share common interests and elevators, is there a process in place? And I know that people cannot be named due to privacy reasons.
So the notification would be specific to close contacts in those environments, mostly because it's a large building and general notification may not be really relevant for people who are not involved or in close contact. Of course, the individual, if they're working in an environment and they're working in a suite of offices with other people and they want to make sure others around them know, they always have the right to provide that information. But we, as of right now, we haven't decided that we would notify the entire building. I definitely want people to remember that every time you enter a public space right now, you need to take precautions. And whether that's going to the grocery store or going to an office building, you should have a mask. You should social distance as much as possible. Before COVID, I was always an advocate of taking the stairs if you could. So avoiding elevators is not a bad thing. It's good exercise too. But remember, social distancing, wearing your mask, and washing your hands will really provide you protection in situations where you don't know. I mean, anytime you go into a big building, you don't know how many others are around you that may be sick, or, you know, other opportunities where you might be exposed unknowingly. So we are trying to provide some general notification, but some of the larger buildings that cover multiple departments may be more difficult to provide consistent notification to every person that enters the building.
And I'd just like to kind of add in right quick though, as far as, you know, she mentioned the staircases and different things, is, you know, there are sometimes people are concerned about when there is a positive case, you know, these locations where people have passed through. So whether it be a staircase or a hallway or, you know, just a place where people are walking through, those are not locations, like I said, not a significant amount of time that's been spent there. That's not an area that we necessarily would be concerned as far as a contagious location. You know, sometimes people get a little concerned about an individual in a location and they think the whole building, you know, needs an action. And like I said, we're looking at areas where a person has spent a significant amount of time, and sometimes that may be one room, sometimes it could be 3 or 4 rooms. You know, it depends, you know, especially if, you know, a teacher is sharing multiple rooms, that obviously would come into play. But as far as just pass-through locations, generally speaking, that's not a huge concern in that respect. So I just wanted to clarify that from an earlier answer.
So I know we're going towards the Plan B, but just curious to know if we have done anything to update the information, the survey about teachers who plan on teaching remotely, or if they have the option with this hybrid Plan B, and what are the responses of any of the updated surveys that have come through from the teachers in our district?
Sorry, could you, if that's for me, could you repeat that again? I'm sorry.
It's actually for anybody.
Okay.
But have any of you, like with the updated, because we know that we're moving towards a Plan B, and this hybrid plan, has anyone given the teachers updated information, or is there any updated data about teachers who plan to work in person or to do it remotely? Is there any updated responses from the teachers versus the one that we received at the very beginning?
I think that information with regard to which teachers will be working in schools versus the remote academy, and those will be coming out very soon. So those decisions are still being made, but it will be coming out very soon. The one other thing I wanted to just highlight was there were a number of questions with regard to request to, if I am taking care of a child or someone tests positive and I have to quarantine, do I have to quarantine? Do I have to have the ability to work from home? And, you know, one of the things I wanted to highlight was some positions you will, you know, may have the option to work from home. And I referenced that you need your supervisor approval, but there are some positions that may not lend themselves to be able to work from home. And that's why the leave is available. So if you fall into any of those categories, which I think there are about 4 or 5 categories. So if you have to isolate, if you have to quarantine, if you're waiting for test results, if you have been a close contact, or if you're caring for a child, those are reasons that would qualify you under the FFCRA paid leave. So if you don't have the option to work remotely or work from home, you do have the option to take advantage of the paid leave for up to the 80 hours, whereas you won't have to take any of your sick leave time or annual leave time during that time period.
Colette, could you just spell out as well? We've got a couple of questions about that paid leave. Does that pay employees at 100% of their pay rate?
The ones that cover you at 100% would include if you're caring for someone who has been quarantined or isolated, or an individual that has symptoms and they're seeking a medical diagnosis, or they've been advised or ordered to self-quarantine or isolate by a healthcare provider. Those individuals would be paid at 100%. There is one which a person will qualify if they have a child and their school or their child's childcare is closed, then that person or those individuals will qualify for the emergency FMLA portion of the paid leave, which is at 2/3 of their pay for up to 12 weeks. And these leaves are all available through December of 2020. If there's any changes in legislation, then we would update our records as well so that it would reflect that.
I can ask another question. How would we quarantine how would a school counselor quarantine? They rotate from classes to classes in contact with multiple students. What would happen if a student from a class A that they have visited is tested positive for COVID? What would I do to quarantine? How would I be able to still do my job?
So I can take part of that. Again, I would say every case is handled on an individual basis, and it would really depend on the situation, how close contact the counselor was involved with one-on-one with the student. Certainly, if it was a brief encounter, just like walking through the hallway or checking in on a classroom and social distance was maintained, that would be less of a concern than if the counselor was in a small room with the student for a session over 30 minutes, then they would be instructed to quarantine during that period. We wouldn't quarantine every classroom that was at all impacted because there may not have been close contact, and it really would just be a case-by-case situation. The last part of the question, I think, was, would they be able to work remotely?
Yeah, yes, ma'am.
So as long as the supervisor approves them to work remotely, they will be able to work remotely. If the counselor is either seeking a diagnosis or has been ordered to self-quarantine by a healthcare provider, then they'll be able to apply for the FFCRA leave.
I have a question for HR. One of the original statements for why we went towards remote learning was because of staffing issues like bus drivers, nurses, and some of the teachers. Has anything changed, and have these positions been filled that you know of?
This morning, we had a public meeting in which we were sharing information with regard to the metrics. And one of the things that came out of that meeting was that we feel prepared to open, or not open, but brings children back into the school based on our current numbers from a staffing perspective. So my understanding is that we feel pretty good about where we are if we were to move to phase B, the B schedule with only certain numbers of students entering the school building from a phased approach.
So I have a pretty heavy hitter one that came in from a fellow CMS English teacher. And the question is, it's pretty hard. My question is, how will the district deal with the death of a teacher after the death of 28-year-old Demetria Bannister from Windsor Elementary in South Carolina? Demetria was diagnosed with COVID only 3 days before she died. How is the death of a teacher, a student, or family member preferable to students temporarily losing out on some social and educational growth when the death of a teacher like Demetria is permanent?
Yeah, that's it's a tough situation. And one thing I would say is, unfortunately, we do deal with unexpected deaths of staff and students. And we do have a great support services team in place to provide assistance for students and schools. And again, we have our life care program that we do provide support for our staff outside of the impact in the schools, but recognizing that that is a tough situation to imagine going through.
And Monica, if I could just build on, I'm sorry, Colette.
No, go ahead,
I'm
Laura.
going to say the same thing. If I could just build on that a little bit. This is I think someone used the word trauma, maybe it was you, Monica. These are traumatic times, not just when we confront a death, but just everything that we're seeing. And we're feeling that stress with our staff. And so the life care services that we mentioned, we are trying to put that out there to as many staff as we can see, so it's available. Not only is that offering counseling services for families, but they have lots of resources as well for childcare, just referrals, things that you wouldn't necessarily think about. This is huge for our staff. Our staff is our family too. So just encourage you and even as supervisors to get those resources out there so we can make use of them.
And one other thing I did want to clarify just with regard to what's covered under the paid leave, because some of them are at 100% and some of them are at 2/3. So just to clarify, the ones that will be covered at 2/3 is if a person is actually caring for someone who tests positive, that would be at 2/3. So just wanted to make sure that I clarify that. And then for those with childcare, that is 2/3 of your pay as well.
So Monica, you talked a lot about case by case. So you talked a lot about 15 minutes and social distance. Can you talk a little bit more about how, I guess, a school will determine, or the Mecklenburg Health Department will determine whether this needs to be quarantined or not?
Yeah, so we do use those terms as if we're all walking around with a yardstick and a stopwatch, and we recognize that those are estimates and approximate interactions. So I also talked about it being an investigative process, and part of what has to happen is really some conversations around who you were working with, who you were interacting with. Many teachers keep real close lists of where kids are seated to help ensure they know anybody who was in the vicinity of another student in the case of a situation where they do have to figure out who was a close contact. Some of it is, it's our best understanding and assessment of the situation. We can't verify that every single person that you were within 2 feet of for 15 minutes was identified, but these are our guide rails that we use to make sure that we're protecting as many people as we can and identifying. We really want to identify people who may have been exposed to prevent additional exposures. And so if we over-identify, that's great because we're just protecting more staff and students from becoming infected.
So like, are those questions or guidelines readily available for someone to find online? Like, where would we find them if we were looking for them?
As far as the contact tracing piece?
The contact tracing, the 15 minutes, you know, everything you just stated. Like, where can we find those, I guess, guidelines?
So there's resources for supervisors who may have to do some of this investigation in conjunction with the health department. We have resources on our website for employees as well. And I would also recommend that people check out our Mecklenburg County Public Health website because there's a lot of information. There's information about what you need to know if you have to quarantine. There's information about where to get tested. There's a public health hotline that the health department puts out that's also a really great resource for anybody in the community. If you just have questions, you can call them. If you actually test positive or are concerned that you might be a close contact, you can call as well. That phone number is 980-314-9400. And I recommend if you have just random questions or concerns, it's a great place to start. We're putting out resources all the time for our staff on the intranet as well as the outward-facing website to provide information in general, but also specific information based on your role. So like I said, for supervisors who might need to ask some of those questions, they would have those resources, and we're available as well to help support. The other resource I want everybody to remember is we have school nurses in our schools, and they are contracted with our county health department. So they're all health department employees and are another direct line to our public health experts.
One last, can you define the difference between having a nurse at a school versus a nurse coverage?
So that's a great question. A nurse, so every traditional school has a nurse assigned to their school. And often, every year, not just this year, but every year we have vacancies in positions, and the nurses, other nurses have to cover those positions. So for example, your school may have a vacancy and the school down the road has a full-time nurse that provides coverage to your school in addition to her school. And so that coverage means she may not be there a full 8 hours during the school day, but would be available for triaging over the phone and resources as far as the supervisor for the nurse as well.
Thank you.
I have an FFCR question. I know we talked about that a lot, but it came up. It says, will teachers be able to use the FFCR if their children have been enrolled in virtual school in South Carolina, for example, and cannot attend school until the end of the year? Is CMS prepared to provide any support for teachers who are not high risk, but just need help with childcare?
So the employee will be able to apply for FFCRA. They will have to submit an application to the leave department, and then we'll have to look at to make sure they qualify, and then we'll approve the leave, and then they'll be able to take the leave. Keep in mind the leave is up to 12 weeks, and it is 2/3 of their salary.
And we're going to have to make that the last question. We did commit to ending this at 5:30, but we will continue to have more dialogue with our employees and our school-based staff as we move forward. I did want to acknowledge that we've seen in some of the comments from those of you following along on the live feed, a lot of questions about the plan for returning to in-person instruction. We can say that it was announced at the board meeting, the Board of Education meeting this week, that there will be a special meeting next week on Wednesday, the 16th, at which time it's expected that the board will receive updated information such as updated metrics, and also will be presented some recommendations on opening, and then at that time, more decisions will be made. In the time leading up to that, there will be more information shared with principals and with school-based staff to prepare the way for that meeting. And then after that, as we do get closer to a return to in-person instruction in what is likely to be a phased approach. Want to thank our panelists for joining us, especially thank Haley and Kim and Amanda for providing that perspective from our school-based staff. And we'll just reiterate that we're committed to making sure that voices are heard as we move closer to some changes that would bring us to in-person instruction once again. Thank you everybody for your time. This session will once again be recorded. A link to the recording will be provided, as well as links to some of the information that we shared. And I believe there's one more comment maybe that Laura wanted to share before we close out.
I'm sorry, Patrick. Yep, I just wanted to let you know, if you are a school-based staff member, please check your email. You should have received an email this evening or this afternoon giving you information about a My Talent course that's going to be specific to safety protocols and procedures for returning to work. That is a required course for all school-based staff. It's going to be due, again, on My Talent, it's going to be due by September the 23rd. There are 2 additional courses that are also going to be in that email that you'll see. If you are a school-based staff member and you're assigned duties as a symptom screener for students, or if you're school-based staff and you're assigned to monitor an isolation room or be a person that's caring for somebody that may have tested positive, there are additional courses there that are going to be required for you to take through My Talent. So again, it's a tight turnaround, September 23rd to complete those. So make sure you get in there and get those.
Thank you for that reminder, Laura. Sorry I cut you off before you got started. But just to close it out, there will be a recording of this forum that can be accessed later and viewed again, or viewed for those employees and school-based staff that did not have a chance to attend during the live session. And all of the resources, including the information that Laura just mentioned, we will provide links to those training materials in what we send tomorrow with the link to the recording. Thank you everybody for your time.